Stand up right now. Stand the way you normally stand when nobody is watching. Look down at your feet. Are they pointing straight ahead or turned outward like a duck? Feel the back of your neck. Is your head sitting directly over your shoulders or jutting forward toward the screen? And your lower back, is there a natural curve or is it completely flat? Most people have never checked. Most people have no idea what they would find. If your head is forward, your feet are turned out, or your lower back is flat, your spine is under chronic mechanical stress right now that is compressing your discs and accelerating cartilage breakdown. And here is what nobody tells you. Most people think spinal damage is about age. It is not. The research is clear. Spinal degeneration is primarily driven by mechanical loading patterns, not by the passage of time. The same spine at 55 can be structurally sound or severely compromised, depending entirely on what you do with it for 16 hours every day. I'm Dr. Arthur Sterling. Subscribe right now and hit like. What comes next? Nobody will tell you at your next appointment. To understand why these habits destroy your spine, you need to understand what the spine actually is and how it fails. Your spine is a column of 33 vertebrae, individual bones stacked on top of each other, with intervertebral discs sitting between each pair of vertebrae. These discs are the shock absorbers of the spine. Each disc has two components, a tough outer ring called the annulus fibrosus and a gel-like inner core called the nucleus pulposus. The nucleus pulposus is 80% water when you are young. It absorbs compressive load and distributes force evenly across the vertebrae. As it dehydrates with age and chronic mechanical stress, it loses height and elasticity. The vertebrae move closer together and the disc can no longer protect them. This process is called disc degeneration, and it is not inevitable. It is accelerated by specific, correctable mechanical errors that most people make every single day. The spine also has a system of supporting muscles, the deep stabilizers called the multifidus and transversus abdominis, which hold the vertebrae in correct alignment under load. When these deep stabilizers are weak or inhibited, which happens after as little as 2 weeks of sedentary behavior, the spine relies on passive structures like ligaments and discs to absorb load they were never designed to handle. This is when damage begins. Not from dramatic injury, from ordinary daily loading on a spine that has lost its muscular support. Here are the 7 habits that are silently accelerating spinal damage. Go through this list honestly, because every single one of them is a daily behavior, not a dramatic event. Habit 1. Sitting for more than 45 minutes without moving. Sitting is the most mechanically damaging position for the lumbar spine. When you sit, the natural lumbar curve flattens. The load on the L4 to L5 and L5 to S1 discs, the two most commonly herniated discs in the human body, increases by approximately 40% compared to standing. After 45 minutes of continuous sitting, the deep spinal stabilizers begin to fatigue and switch off. The disc begins absorbing load without muscular support. Fluid is slowly squeezed out of the nucleus pulposus. Every additional minute of uninterrupted sitting compounds this compression. The fix requires 0 additional time. Stand up, walk for 60 seconds, and sit back down. That brief interruption reactivates the stabilizers and allows fluid to re-enter the disc. Habit 2. Looking down at your phone. The adult human head weighs approximately 10 to 12 pounds in neutral position. When the head tilts forward, the effective load on the cervical spine multiplies dramatically. At 15 degrees of forward tilt, a slight downward glance, the effective load on the cervical spine increases to 27 pounds. At 45 degrees, the angle most people hold when looking at a phone, the load reaches 49 pounds. People spend 2 to 4 hours per day in this position. That is 700 to 1,400 hours per year of the cervical spine supporting nearly 50 pounds. This produces a specific deformity called forward head posture, where the head permanently migrates forward from its neutral position over the spine. Habit 3. Sleeping on your stomach. Of all the positions the human body can assume during sleep, prone, face down, is the most mechanically damaging to the cervical spine. Stomach sleeping requires the head to be rotated to one side for the entire duration of sleep, typically 6 to 8 hours. This sustained rotation compresses the facet joints on one side of the cervical spine and stretches the soft tissue structures on the other. Over years, this produces asymmetric cervical degeneration. One side degenerates faster than the other. It also forces the lumbar spine into extension throughout the night, compressing the posterior elements of the lower back. Habit 4. Lifting with a rounded lower back. The lumbar spine is designed to transfer load when it is in its neutral curve, a slight inward arch. When the lower back rounds during lifting, a position called lumbar flexion under load, the posterior annulus fibrosus of the disc is placed under extreme tensile stress. This is the primary mechanism of disc herniation. The nucleus pulposus migrates backward through the weakened annular fibers and can compress the nerve roots exiting the spine. This happens not only with heavy lifting, it happens every time you pick up a grocery bag, load the dishwasher, or reach into the back seat of a car with a rounded lower back. Habit 5. Carrying a bag or purse on the same shoulder every day. The spine functions as a balanced column. When weight is consistently applied to one side, the muscles on that side contract continuously to compensate. Over months and years, carrying weight on the same shoulder produces measurable asymmetry in spinal muscle development. One side stronger, one side weaker. The spine begins to curve laterally toward the loaded side. This is a form of functional scoliosis, a curvature caused by habitual asymmetric loading, not by structural abnormality. Habit 6. Wearing flat shoes or going barefoot on hard floors all day. The foot is the foundation of the entire skeletal system. When the arch of the foot collapses, a process dramatically accelerated by flat, unsupportive footwear on hard surfaces, the entire mechanical chain above it compensates. Collapsed arches cause internal rotation of the tibia, which shifts the knee inward, which tilts the pelvis, which flattens the lumbar curve. Every step taken in flat shoes on a hard floor sends an unabsorbed impact directly up the skeletal chain to the lumbar spine. Over thousands of steps per day for years, this cumulative impact produces progressive disc compression in the lower spine. Habit 7. Never training the posterior chain. The posterior chain, the muscles running along the back of the body, primarily the glutes, hamstrings, and erector spinae, is the primary active support system for the lumbar spine. When the posterior chain is weak, the lumbar spine has no muscular protection under load. The deep stabilizers cannot function effectively without the foundation of strong glutes and hamstrings beneath them. Most people's fitness routines heavily emphasize the front of the body, chest, quads, abdominals, while the posterior chain receives almost no direct training. The result is a spine that is structurally unsupported from behind. Let me tell you about a patient I will call Michael, 54 years old, software architect. He came to see me with what he described as a dull ache in his lower back that had been present for 3 years. Never severe enough to stop him working, never bad enough to make him see a doctor until his wife insisted. He had tried a chiropractor twice. It helped for a day. He had tried a massage therapist. Same result. He had been told by a colleague that his back pain was probably from his mattress. He had bought 2 new mattresses. Nothing changed. I asked him to describe a typical workday. He sat from 8 in the morning until 6 in the evening, with breaks only for lunch. He worked on a laptop on a kitchen table, head down, shoulders rounded. He commuted 40 minutes each way, sitting. In the evenings, he watched television, sitting. I asked him to stand up and walk across the room. His feet were turned out at approximately 30 degrees, classic gluteal inhibition pattern. His head was approximately 3 inches forward of neutral. And when I asked him to bend forward and touch his toes, his lower back rounded completely. The lumbar curve reversed entirely under minimal load. I did not send Michael to a surgeon. I did not prescribe him anything. I referred him to a physiotherapist with a specific brief: posterior chain activation, lumbar stabilization, and forward head posture correction. 8 weeks later, Michael came back. He had done 20 minutes of specific exercises every morning before sitting down at his computer. His pain had reduced by approximately 70%. His feet were pointing closer to straight. His head had come back over his shoulders noticeably. His lower back maintained its curve when he bent forward. Nothing about his anatomy had changed. Everything about his mechanics had changed. The spine does not degenerate because it is old. It degenerates because nobody taught it how to carry load correctly. Here is a 4-part assessment you can do right now. First, the wall test. Stand with your back against a wall, heels 2 inches from the baseboard. Your buttocks, upper back, and the back of your head should all touch the wall simultaneously. If your head cannot reach the wall without forcing your chin up, you have forward head posture. If there is more than 2 finger widths of space between your lower back and the wall, you have excessive lumbar lordosis. If you cannot get your head to the wall at all without pain, your cervical degeneration is already measurable. Second, the single leg stance test. Stand on one leg for 10 seconds without the other foot touching the ground or your upper body swaying significantly. If you cannot hold this for 10 seconds on each side without wobbling, your deep spinal stabilizers and glutes are insufficiently activated. This single test predicts lower back injury risk with clinical accuracy. Balance is not a fitness metric. It is a spinal protection metric. Third, check your sleeping position tonight. If you wake up on your stomach, your cervical spine has been under sustained rotational load for hours. And fourth, look at your shoes. If the inner edge of the heel is more worn than the outer edge, your arches are collapsing and your mechanical chain is compensating from the ground up. Spinal degeneration generates enormous revenue for the healthcare system. MRI scans, steroid injections, surgical consultations, spinal fusion procedures that cost between $80,000 and $150,000 and have a success rate that is far lower than most patients are told before they consent. A 2014 study in Spine Journal found that patients who underwent spinal fusion surgery for non-specific lower back pain had no significantly better outcomes at 2 years than patients who received structured physiotherapy. The surgery costs $100,000. The physiotherapy costs $2,000. Both produce similar results. One of them generates revenue. One of them does not. This is not an argument against surgery for specific structural indications. It is an argument for exhausting the mechanical correction approach, which is almost never adequately tried before surgical options are presented. Here is what the evidence actually supports. Stand up from sitting every 45 minutes. Set a timer. Raise your phone to eye level, not your head to phone level. Sleep on your side with a pillow between your knees or on your back with a pillow under your knees. Hinge from the hips when lifting, not the lower back. Alternate which shoulder carries your bag daily. Replace flat shoes with footwear that has arch support and cushioning. And train your posterior chain, specifically glute bridges, bird dogs, and deadlifts with correct form 3 times per week. Spinal degeneration is present in 90% of people over 60 on MRI imaging. But MRI findings do not equal symptoms. Many people with severe degeneration on imaging have no pain, and many people with significant pain have minimal imaging findings. The relationship between structural degeneration and pain is mediated almost entirely by mechanical loading patterns. Correct the mechanics, and symptoms frequently resolve, regardless of what the imaging shows. How old are you? Write it in the comments right now. I want to know who is watching, because the spinal conversation at 45 is different from the conversation at 67. And what I cover next will be shaped by exactly where you are. Here is your action plan. Do the wall test today. Note whether your head, upper back, and buttocks touch simultaneously. Do the single leg stance test, 10 seconds each side. Set a 45-minute timer for every sitting session starting tomorrow. Raise your screen to eye level this week. Check your shoes. Replace flat, unsupportive footwear. Start glute bridges every morning, 3 sets of 15 before you sit down for the day. And if you wake on your stomach, put a pillow against your front to discourage it. Your spine has been carrying you without complaint for decades. The 7 habits I described today are not dramatic. They are ordinary. They happen quietly, every day, without pain, until the damage is advanced enough that pain can no longer be ignored. I'm Dr. Arthur Sterling. I have spent 15 years watching patients arrive for surgical consultations for conditions that were entirely preventable with mechanical correction that nobody had ever taught them. Subscribe, hit like, and send this to someone whose back you want to keep moving. The healthcare system profits from spinal surgery. I profit from making sure you never need it.